Hey everyone, welcome back to all my listeners. This is episode 17 in season 15. Today is Wednesday, August 27th, 2025. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, let's just go ahead and dive right into today, right? This is going to be a big episode. It's going to feature, as my very last episode in the month of August, it's going to feature my Newsworthy fraud, waste, and abuse highlights for the entire month of August as of the recording of this episode. And of course, I'm going to be spotlighting some of those from the month's criminal and civil enforcement cases that I find newsworthy. And I'm going to go ahead and round out today's episode with another remarkable quote on hopes and aspirations by Rupi Kaur. All right, you guys, let's get into it. So in today's newsworthy, the month's fraud, waste, and abuse cases. The month of August saw a whopping 42 cases as of the recording of this episode. Now, it's less than the month of July's bonanza month of takedowns, right? But newsworthy nonetheless. So let's go ahead and check out some of these cases that I've put in the spotlight. Early August saw A.G. Campbell securing $6 million in settlement with Weymouth-based ambulance companies for mass health false claims. The AG's office has reached a $6 million settlement with two Weymouth-based ambulance companies and their current owners. The settlement resolves allegations that the companies and owners submitted false claims to Mass Health for more expensive services than were provided, violated Mass Health medical necessity requirements, and failed to disclose relevant information when submitting the company's applications to serve as Mass Health providers. As part of the settlement, the company and owners will pay $6 million to Commonwealth and implement a 3-year independent compliance monitoring program at their own expense. The compliance monitoring program will include updated policies and procedures, training requirements, and annual site and record audits, the results of which will be reported to the Attorney General's office, the AGO. Now, the companies provide ambulance and wheelchair transportation services to Mass Health patients across the greater Boston and South Shore areas. Collectively, they are the largest medical transportation provider in the Commonwealth. Per its investigation, the AGO alleged that the companies fraudulently upcoded their claims to Mass Health by billing for more expensive levels of services than they actually provided or required, including billing for emergency services when only non-emergency services were provided or required. Additionally, the AGO alleged that the companies fraudulently billed Mass Health for medically unnecessary services and/or for non-emergency services without maintaining relevant medical necessity documentation as required by Mass Health. Furthermore, in violation of Mass Health medical necessity requirements, the AGO alleged that the companies also requested medical authorization signatures from providers without presenting relevant and completed medical necessity documentation as required. Additionally, the AGO alleged that when submitting their Mass Health provider applications, the companies failed to disclose to Mass Health relevant information concerning owners, managers, and employees of the companies. The AGO asserted that this conduct constituted violations of various state laws, including the Massachusetts False Claims Act. These allegations were first uncovered through a whistleblower lawsuit filed in the District of Massachusetts. Early August also saw a CEO of a spine device company sentenced for false statements in connection with mandatory reporting to CMS. The founder, president, and CEO of a spine device company was sentenced in federal court in Boston for making false statements to the Centers for Medicare and Medicaid Services, CMS. This man is a doctor, founder, president, and CEO of a Massachusetts-based medical device company and was sentenced to 1 year of supervised release with the first 6 months to be served in home confinement. The defendant was also ordered to pay a fine of $9,500 in addition to the $40,000 the defendant personally agreed to pay as part of a related civil settlement and $855,000 his wholly owned company agreed to pay as part of the same settlement. In May 2025, he pleaded guilty to 1 count of false statements. Pursuant to the Physician Payment Sunshine Act, device manufacturers like this one are required to report any payments or transfers of value to physicians, including spine surgeons. CMS maintains a database via the Open Payments website, which makes all such payments or transfers of value publicly accessible. This spine device company offered surgeons the opportunity to engage in purported consulting on product development. Specifically, the CEO directed his employees to report the payment of fees paid to a surgeon as consulting fees that were not compensation for actual consulting work. He caused his companies to report a payment of $4,750 on January 19, 2016, to the surgeon as a consulting payment, even though the man knew that the surgeon had not performed actual consulting work for the payment. He also knew that he and his company were required to accurately report any payments or transfers of value to the surgeon. Now, mid-August also saw a Richmond psychotherapist convicted of healthcare fraud to pay over $1 million. A licensed clinical social worker who was convicted of criminal healthcare fraud has agreed to pay an additional $449,000 and some change to settle civil fraud claims asserted against him by the United States and the Commonwealth of Virginia. According to court documents, between January 2017 and December 2022, this LCSW knowingly submitted at least $335,824.31 in fraudulent claims for reimbursement to Virginia Medicaid and Medicare for services that were not rendered. These included claims that billed for more than 16 hours in services in one day, or that used billing codes for more complex services with higher rates than the services that were provided. To support his fraudulent claims, the man used false psychotherapy progress notes reflecting the patient's supposed receipt of services. He pled guilty to healthcare fraud on October 17, 2024, and on March 13th was sentenced to 3 months in prison. As part of his criminal case, he paid over $316,000 in restitution and was ordered to pay over $335,000 in forfeiture and an additional $100,000 fine. To resolve the civil fraud claims against him, he agreed to pay an additional $449,000 and change. The restitution, forfeiture, fine, and settlement total over $1.2 million. Now, mid-August also saw the United States obtaining more than $1.4 million in judgment against a family medical practitioner for fraudulent billing. The U.S. Attorney's Office for the District of Maryland announced that it obtained a judgment of over $1.47 million against a family medical doctor and his practice located in Tacoma Park, Maryland. Now, the U.S. District Court for the District of Maryland found that he submitted or caused the submission of false claims to the Medicare program in connection with his use of auricular stimulation, or P-stim, devices. In his practice, the doctor used P-stim devices to treat patients for pain. A P-stim device provides electrical acupuncture to treat pain symptoms and is applied externally to the patient, generally behind the patient's ear, using an adhesive to hold the device in place. Acupuncture, electrical or otherwise, is not reimbursable by Medicare. The United States filed a complaint against him, alleging he falsely billed Medicare using a code for an implantable neurostimulator device, which is surgically implanted into a patient and typically performed by a surgeon in an operating room. He fraudulently billed Medicare for this complex neurosurgical procedure numerous times from approximately January 17th of 2019 through May 1st of 2019. Now, mid-August also saw a Connecticut lab, its owners and officers, to pay more than $1.2 million to settle False Claims Act allegations. A lab and its owners and officers have entered into a civil settlement agreement with the federal and state governments and agreed to pay more than $1.2 million to settle allegations that they submitted false and fraudulent claims to government healthcare programs for medically unnecessary urine drug tests. The government alleges the lab and its owners and officers committed fraud in two ways. First, they submitted claims for medically unnecessary urine drug tests for Medicare and Medicaid beneficiaries residing in sober homes solely for the purposes of residential monitoring, which was explicitly prohibited. Second, they submitted claims for medically unnecessary duplicative urine drug testing. Now, there are several different types of urine drug testing. A screening test, also called a presumptive test, detects the presence or absence of certain classes of drugs, such as opiates, cocaine, and amphetamines. A screening test does not measure the specific amount of the drug present in the patient's urine sample, but provides only a positive or a negative result, indicating the presence or absence of a detectable drug. Now, a confirmation test, also known as a definitive test, is a more precise and more expensive test that determines not only whether a particular drug is detectable in a patient's urine sample, but also the specific quantity of the drug that is detected. Now, the government alleges that the lab and its owners and officers routinely conducted testing on Medicaid and Medicare patients using both types of tests at the same time on the same day. No practitioner reviewed the results of the screening test first to determine if it was medically necessary to also utilize the more expensive and precise definitive test. Accordingly, government health care programs were routinely billed for both types each time a Medicaid or Medicare patient was tested. To resolve the government's False Claims Act allegations, the lab and its owners and officers have agreed to pay over $1.2 million, which covers the time period from September 2021 through December 2023. August also saw 4 men, including 2 doctors, charged in a $7 million illegal opioid distribution conspiracy. An indictment was unsealed, charging 2 doctors, the owner and operator of a medical clinic, and a patient recruiter with conspiring to illegally distribute prescription drugs. The indictment alleges that from November 2023 through June 2025, the foursome and others issued thousands of opioid prescriptions for supposed patients who did not have a legitimate medical need for these drugs. The defendant's conspiracy resulted in the illegal distribution of oxycodone, Percocet, Norco, oxymorphone, and promethazine with codeine, which are among the most addictive and abused opioids that also have a high street value. The indictment further alleges that the 2 doctors issued prescriptions for more than 400,000 dosage units of Schedule II opioids with a conservative street value of more than $7 million. Medicare and Medicaid programs were also fraudulently billed for over $1 million in medically unnecessary prescription drug medications and maintenance medications during this conspiracy. An indictment is only a charge and is not evidence of guilt. Each defendant is entitled to a fair trial in which it will be the government's burden to prove guilt beyond a reasonable doubt. August also saw an Alabama doctor charged with a $6 million telemedicine healthcare fraud scheme. An Alabama doctor has been charged and has agreed to plead guilty in connection with a $6 million telemedicine fraud scheme involving medically unnecessary durable medical equipment, or DME, as well as genetic testing primarily used to detect mutations in genes that could indicate a higher risk of developing certain types of cancers. A 43-year-old doctor has agreed to plead guilty to 1 count of healthcare fraud. A plea hearing has not yet been scheduled by the court. According to the charging documents, between December 2018 and March 2021, he worked with telemedicine companies to sign medical documentation, including doctors' orders for medically unnecessary durable medical equipment and genetic testing. It is alleged that these orders signed by the doctor were pre-populated based on telemarketing calls made to the Medicare beneficiaries that he never had any contact with, the beneficiaries himself, and had no medical relationship with the patients. DME suppliers and laboratories ultimately submitted claims to Medicare for these signed orders. As a result of his alleged participation in this scheme, over $6 million in claims were allegedly submitted to Medicare for DME and genetic testing that were medically unnecessary, based on false documentation and tainted by kickbacks. The charge of healthcare fraud provides for a sentence of up to 10 years in prison, supervised release for up to 3 years, and a fine of up to $250,000. Sentences are imposed by a federal district court judge based upon the U.S. sentencing guidelines and statutes which govern the determination of a sentence in a criminal case. The details contained in the charging documents are allegations. The defendant is presumed innocent unless and until proven guilty beyond a reasonable doubt in a court of law. August also saw a California behavioral medicine provider agreeing to pay $2.75 million to resolve alleged false claims for psychotherapy services. A California behavioral medicine provider has agreed to pay $2.75 million to resolve allegations that they violated the False Claims Act by submitting false claims to government healthcare payers for certain psychotherapy services. This organization provides behavioral medicine services for individuals and families in the state of California. Since at least 2015, the entity and its providers and its healthcare providers have submitted claims to government payers using the current procedural terminology codes, or CPT codes, 90833 and 90836, which are add-on codes to be used when psychotherapy services are performed in conjunction with an evaluation and management visit, and which require specific documentation. The settlement resolves the government's allegations that from January 1st of 2015 through December 31st of 2022, the organization submitted fraudulent claims using these add-on codes in instances where its healthcare providers either had not provided the services described by those codes or had failed to sufficiently document that such services had been provided. They will pay upwards of $2.6 million to the United States and over $134,000 to the state of California. The claims resolved by the settlement here are allegations only. There has been no determination of liability. And finally, August saw Troy Health, Inc. entering a non-prosecution agreement and admits to fraudulently enrolling Medicare beneficiaries and identity theft. This North Carolina-based provider of Medicare Advantage, Medicare Part D, and dual eligible special needs plans has entered into a non-prosecution agreement with the Department of Justice to resolve a criminal investigation into a healthcare fraud and identity theft scheme involving the use of artificial intelligence and automation software to illegally obtain Medicare beneficiary information and fraudulently enroll beneficiaries into its Medicare Advantage plans. Now, as part of the non-prosecution agreement, this organization admitted that from approximately October 2020 through the end of 2022, they defrauded the Medicare program by enrolling beneficiaries in their Medicare Advantage plans without their knowledge or consent. Now, under a Troy executive's direction, some of Troy's territory managers used proprietary software developed by one of their executives to unlawfully access pharmacy records and customer lists containing sensitive personal information, including patient names, addresses, dates of birth, Medicare ID numbers, and insurance information. They then used that information to make unsolicited sales calls to potential beneficiaries. During those sales calls, the organization's sales personnel provided false and misleading information to Medicare beneficiaries. For example, their sales personnel told prospective enrollees that they were calling on behalf of the beneficiaries' pharmacies and representing to beneficiaries that their Medicare Advantage plan was being offered as a supplement to their existing healthcare plans rather than as a new plan. Troy also used an artificial intelligence-based healthcare management platform it developed and made available to participating pharmacies known as Troy.ai as part of the scheme. Now, as described by the company, Troy marketed Troy.ai as a product that would leverage data and machine learning to lower the cost of care and improve health outcomes. As part of its effort to obtain new enrollments, however, Troy misused the platform by offering pharmacies kickbacks for enrollment referrals submitted through Troy.ai. Troy also admitted that it used information obtained from the customer lists to enroll beneficiaries in Troy's Medicare Advantage plan without their consent. At the height of the scheme during the Medicare Advantage open enrollment period between January 1st, 2022 and March 31st, 2022, Troy enrolled over 2,700 new Medicare Advantage members, many through automatic or batch enrollments. For example, on March 2nd, 2022, Troy enrolled over 300 beneficiaries on one day, with the enrollments occurring approximately 1 minute apart. In addition, some Troy employees manually entered fraudulent enrollments through the Centers for Medicare and Medicaid Services website. This conduct followed a Troy executive's announcement at a 2021 board meeting of an aggressive but achievable plan to triple Troy's enrollment through the 2022 open enrollment period. As part of the non-prosecution agreement, Troy admitted to and accepted responsibility for the acts of its officers, directors, employees, and agents in connection with the scheme. Troy also has agreed to continue cooperating with the Department of Justice in any ongoing or future criminal investigation relating to this conduct. As part of this agreement, Troy agreed to pay a criminal penalty of over $1.4 million. This penalty has been adjusted based on Troy's ability to pay. The department reached this resolution with Troy based on several factors, including their efforts to provide all relevant facts known to it, acceptance of responsibility for criminal conduct, extensive and timely remedial measures taken, commitment to continuing enhancement of compliance and internal control programs with federal agencies in any ongoing investigations, and the nature and seriousness of the offense. Troy did not receive voluntary self-disclosure credit, but did receive credit for its cooperation with the department's investigation and affirmative acceptance of responsibility, which included 1, self-reporting of its 2022 batch member enrollment issue to CMS before it had come to the attention of the department. 2, providing timely updates on facts learned during its internal investigation. 3, providing all relevant facts known to it, including information about individuals involved in the conduct. However, and particularly during the early phase of the department's investigation, Troy failed to preserve and produce certain documents and evidence in a timely manner, and at times took actions that were inconsistent with full cooperation. And finally, I focus season 15 Spark on hopes and aspirations. I want this 15th season Spark to be filled with our world's thought leaders, writers, artists, philosophers, everyone whose words provide us with their insights on hopes and aspirations. So in this week's inspiring quote in Spark is from Rupi Kaur. Do not bother holding on to that thing that does not want you. So very true, right? This is an incredibly hard lesson to learn for sure. But this level of self-belief and self-worth, the high hopes you hold dear, are everything. This quote reminds me not to be distracted. This quote encourages me to stay on my own path. There is simply no need to follow others. So remember, do not bother holding on to that thing that does not want you. I'm happy Rupi Kaur's spark still burns brightly and continues to inspire so very many. All right, you guys, that wraps up today's episode, the very last episode in the month of August. So I really hope you go back and listen to all of those fraud cases in the spotlight. There are still quite a few more that are going to be coming out here before the month ends on Sunday. But I really wanted to focus on especially those psychotherapy cases. I work on psychotherapy cases very, very often in my everyday work, as well as those add-on codes that were in the spotlight here, right? And of course, I focused on yet another P-stim device case, those auricular devices that are simply taped behind patients' ears. There is no surgeon cutting into them and inserting any type of device inside of the skin. So I know I've talked about that, P-stim devices, Styvex devices, et cetera, on the podcast for a number of years now. That very last case on Troy Health was a big one as well, especially, a lot of the caution we have to take on and our due diligence we have to perform when we are utilizing these types of AI software or AI platforms, et cetera. Now, I wish you guys all an amazing, amazing last few days of the month of August, and brand new month, a brand new page is going to be turned in our calendars, right? The month of September is around the corner. So I wish you guys all an incredible and very, very happy week ahead. Thank you so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.